Hello, I'm Dr. Komal, and today let's dive into what is preconception counseling. So, what do you think is the best period to visit a doctor when you are planning for a pregnancy? Is it after you conceive, immediately after pregnancy? Clearly, the answer is no. So, when we plan any event in our life, it could be marriage or career or home, we plan it before. So, why don't we do this with respect to pregnancy, which is one of the most important journeys of our life? So it is vital that you visit a doctor before conception, before you conceive, so that you have the time necessary to optimize the woman's health, to reduce or modify certain risk factors. She could be having certain conditions like diabetes or hypertension or asthma or epilepsy. So all these can be managed. She could be taking some teratogenic drugs which can have an effect on the baby. So these can be switched over to safer drugs. We will have a window of opportunity to give her advice regarding nutrition, especially taking folic acid supplement, correction of her anemia and any other high risk factors. By doing so, although we will not be able to eliminate all the risks which happens in pregnancy, but we'll be able to reduce it to as minimum as possible and be able to manage a pregnancy in a much better way than seeing her after she gets pregnant. Because most of the time people report to us in the first trimester when the period of organogenesis, that is the baby being formed, is already over. So there is not much scope for us to give her advice regarding how to improve her outcome in pregnancy. So I request everyone to make it a routine to visit your doctor especially when you're planning for a pregnancy or when you're dealing with infertility, or any other time if you're visiting a doctor and you have thought of planning a pregnancy, please talk to the doctor and find out advice about preconception counseling. Thank you.